So if you have a patient that's altered, you need to consider the other reasons why they might be altered. I mean, I kind of know that. My first experience with a huge burn was a guy, his meth lab blew up, and he was completely singed from the waist up, just black, and everything he touched on him fell off. And you know, when trying to get he had rings on and watches and that sort of thing, and when we took him off, it took the skin with it. But he was completely conscious. He knew his social security number. He walked in and told them his name, his birthday, his social security number to be registered. And the only time that he lost consciousness is when we, you know, gave him stuff to intubate him. So just thinking about that, just kind of keep that in the back of your mind. And even 100% burn will not kill you immediately. So I found those two things really interesting. They're terribly painful, yes, and you know, they can take huge amounts of pain medicine, but I found that those two things were really interesting. Electrical burns. What do you think happened to this kiddo?
Probably put something in his mouth.
Yeah, on a cord.
Yeah.
And it blows out. The thing with electrical burns is you have to look for the entrance and you have to look for the exit wound. The exit wounds with electrical burns can be very dramatic. The Shriners were telling us the worst thing they'd seen. A kid was hanging off of a high line. I don't know how he got up there, what he was doing up there, but he grabbed a hold and got the hot wire. And so it actually went in his hand and blew out this side. And they said when it blew out this side, it took his ribs with it. They could see his lungs, his liver, and his kidney. So just think about if it went in here, but it did all that, obviously the damage is going to increase as it goes through. With any electrical burn, you always want to get an EKG, check electrolytes and that sort of thing. They like to go in and kind of liquefy the muscle and hit the bone, and then all that myoglobin that it breaks down goes through and hits their kidneys. So electrical burns typically need at least a third amount more fluids, more than a regular thermal burn. This little kid, that could have been, I don't think it's attached to this picture, but obviously we've got this and then the injury there. He might have been, it looks like he maybe was digging with a knife in an electrical outlet. I don't know why that's so intriguing. My brother did it all the time. You know, you'd catch him and he'd take the knife and pop the little security thing, the little plastic thing, he'd pop that out and stick the knife in. I'm not real sure why. Here's an exit wound. This guy here has got, obviously, an inhalation injury. I'm not real sure if that guy's still alive or not. He's not looking real good for the pictures. But you can see the different color there. He's got, obviously, the very singed, the whole face is singed, so he's going to have the singe to the nasal passages and the hair. And, you can see he's even got stuff on his teeth there. So that's a pretty obvious one. This guy poured gas on a brush pile, flashback and got his face. Also remember, anytime they're wearing cotton clothing, that's going to give them a little bit of protection as long as it's 100% cotton. If it flashes back like that and that guy's dressed in a polyester or some kind of blend that's plasticky, all that's going to melt to him, depending on the melt point and how hot it was when it flashes back. So that can actually flash back and melt all that to their skin. So then they have to have that taken off too. You've got your 3 different types of inhalation injuries. Your carbon monoxide poisoning is the easiest. The treatment for that is just remove them from the source and give them 100% oxygen. You know, the symptoms can vary. If you're a smoker, you already tolerate some amount of carbon monoxide, so they can tolerate more than just a regular person that doesn't smoke on a regular basis. Any injury above the glottis, you've got the singed nasal hair, they'll have the carbonaceous sputum, or, you know, it's real black and junky, nasty looking, and a facial burn. The inhalation injuries below the glottis, those aren't necessarily immediately obvious. A lot of those come from chemical inhalations, and they'll go down and start liquefying the tissues in the lungs, cause a lot of ARDS, pulmonary edema, and they'll take forever to get off the vent if they do come off the vent. You you've got your couple different stages of your pulmonary damage. This first stage is just the respiratory epithelial damage. You'll have a little bit of necrosis and sloughing. That's one of those where if you do a lot of good pulmonary toilet, suction them frequently and get that stuff out of there, turn them, all your ventilator, your BAP is BAP, right? Ventilator pneumonia associated in a different order than that. If you do all that stuff, that'll help them get rid of that. With stage 2, they have bronchoconstriction, they have the atelectasis, so they'll start having the collapsing down there, and you'll start having the airway obstructions in the lower lung fields because all that debris just kind of goes down there and settles. Your early problem, obviously, are going to be your upper airway edema and your bronchospasms. Late, you're going to have your alveolar de-recruitment, your alveolar flooding. They're just going to be drowning in their own lung tissue that's sloughing off, and basically it just sloughs off and goes down and settles in the bases of their lungs. Your 3 different factors that produce inhalation injuries, your carbon monoxide poisoning, like we said, it binds about 200 times more to the hemoglobin than oxygen does. So they can be reading 100% on their pulse ox, just remember that. And most people that I've talked to, I've never seen a true carbon monoxide poisoning that resulted in someone's death or anything. Most people say, the textbooks say they'll have a cherry red. Most people say they just look normal, just like everyday person. So the cherry red's not necessarily indicative of that. But obviously that's just going to decrease your oxygen transport. Your heat, that's going to produce an immediate injury depending on the amount of heat. With any of these, you just want to consider your early intubation, just because alone, if you have a burn greater than 20% on your body, it's going to cause systemic swelling. So if it's localized to the face and chest or whatever, they're going to have even more swelling to that area. So you want to go ahead and get them intubated early, so that they can stay intubated and get intubated. With your chemical inhalation, you've got a lot of railroad tracks. I know in Hardin County, they carried a lot of anhydrous ammonia down there. I don't know what your railroad tracks carry, but just think railroads, they carry a lot of different stuff. A lot of times they do carry a lot of dry chemicals or even tankerfuls of chemicals. So if you have a fire or a derailment or something like that, a lot of that can be released into the atmosphere. And like I said, your chemical inhalations are your biggest risk for ARDS. With your inhalation injuries, obviously you're going to think if they're burned pretty much from here up, they have the potential for an inhalation injury. You're going to have your vascular shift of fluids, and so they can actually tighten up in the chest and make ventilation difficult, especially if they're burned or if it's a circumferential burn around their chest. An eschorotomy is the best treatment as far as releasing that if they have a circumferential burn. With an eschorotomy, they just go in the eschar. It can be any color. They said there's no real prediction for what color that it turns out. It can be red, white, blue, black, brown. And they said it's just, it's hard when you tap on it. So they just take a scalpel and make like an H pattern on the chest. And they said whenever you do that, as long as it's just a problem with the eschar, it'll just kind of pop open, kind of like a hot dog if you grill it and then you poke it. It just kind of pops like that. And that's what they said happens with the chest. Or any other thing. If it doesn't do that and the pressures are still greater than 30 millimeters of mercury, then they'll go ahead and do a fasciotomy. And if it's to an extremity and the pulses don't return, then it's indicative that there's necrotic tissue and it'll need an amputation. So your inhalation burns, we kind of already talked about this. Horse, I don't have one, it's just sinuses. The sooty, nasty sputum, if they're hypoxic, tachycardic, if they've got blistering around their mouth, around their nose, the singed nasal hair, if they've got a lot of edema in their face and throat, and then of course just chest tightness, and they're going to be anxious because they can't breathe. Your carbon monoxide poisoning, like we already talked, their CO2 will be normal. Like I said, in smokers, levels up to 15 in smokers or truck drivers that are exposed to heavy traffic, like New York, Louisville, that sort of thing. In a regular person, greater than 15 to 40, you're going to have the neurologic symptoms, dizziness, weakness, headache, nausea, vomiting. And greater than 40 will produce decreased level of consciousness. Hyperbaric therapy, you guys don't have one. A hyperbaric chamber? Do
Yeah,
you?
we
We
do.
do.
Do you? Okay. So that can be used, obviously that kind of depends on if the patient's stable enough, if it's feasible to get them there. But the first line treatment is just 100% oxygen via non-rebreather. So injuries above the glottis, a lot of these happen in a house fire, especially a new house fire. The old houses were made out of real wood and real fabric and real stuff like that. Nowadays they're made out of, the pressed board has a lot of chemicals in it. A lot of the furniture and stuff is made a mixture, and a lot of it is exposed to chemicals. So if it's caught on fire, all that's released into the air, and that's when a lot of people have these chemical burns that happen deep down in their lungs. Your upper airway is considered down to the level of your true vocal cords. And then, like I said, a lot of these are chemicals. It's good to give the burn patients fluids, but a sufficient amount of fluids. If you give them overload of fluids, it's just gonna go in and come right straight back out. And so that's gonna just increase the swelling